very real, and this is, if you want to think, the ultimate hardware removal. In general, you want to make sure that you have your standard instruments that every company has to be able to place the base plate, but then you need everything else if things kind of go off the rails. And for me, that includes a broken screw set, osteotomes of various sizes and thicknesses, burrs, including a pencil tip burr and as well as metal cutting burr, and then a 90-degree sagittal saw. So you can think of removals of the base plate as either revision light with regards to a standard base plate versus something that's maybe a little bit darker that you know that it's going to take you a little bit longer in the operating room to be able to actually correct. So some quick tips. Osteotome entry locations. There are various locations you can go. First, you can go anterior, just medial to the conjoint, just distal to the tip of the coracoid. You can go percutaneous through Nevisor's portal, and then you can go posteriorly through a portal just inferior to the scapular spine. Second point or tip is if you have a posted base plate, before disimpacting the base plate, make sure that you rotate it. And so very simple, straightforward, debond the post, and then you can disimpact the post. And then finally, if you're going to use if you need to use a screw removal set, I'll typically take a femoral head allograft and I'll cut it in a checkerboard pattern so that you have probably squares that have about 5 millimeters to a centimeter on each side. And then you'll take these little pegs and then just tamp them into the holes that you've had, and they look like little French fries when you put them in. Pretty simple. Anytime you take a base plate out or you're trying to get exposure, Carolyn talked about this, humeral work is important. So on the humeral side, you want to make sure you have appropriate resections. You need to do releases of the soft tissue.